Case study of diabetes mellitus presented to Dr. Cik Suhaili binti Cik Taha. This is our group members Nur Syahira binti Kamaruddin, Nur Syazwani binti Jalil, Nur Zakira binti Zuli, Izzati Hidayah binti Muhammad Zaid, and lastly Suryani binti Awang Muhammad Elias Aziz. We are from class of dietetics.
Introduction. The nutrition care process, or also known as NCP, aims to increase the accuracy and reliability of customized case management for patients, clients, or groups, as well as the prediction of patient outcomes. There are 4 steps involved in the NCP. The first one is nutrition assessment, where the dietitian can obtain many data and information from the patient. Second is nutrition diagnosis, which involves the nutritional problem that the dietitian needs to treat. The third one is nutrition intervention, that consists of objectives and principles for treating the disease. The last step is nutrition monitoring and evaluation, which is done to monitor and assess the effectiveness of the prevention to the disease and the patient's outcomes. The case study that our group is going to present is about type 2 diabetes mellitus, which is a metabolic condition characterized by excessive blood glucose levels because the insulin cannot function efficiently.
Assessment for diabetes mellitus. Nutrition assessment is a systematic method in obtaining, verifying, and interpreting data needed to determine whether a person or groups of people are well-nourished or malnourished. It can be obtained through ABCD method, which is anthropometry, biochemical, clinical, and dietary. Food or nutrition-related history. Mr. BH is 48-year-old male which has been referred to diet clinic for diet consultation on his newly diagnosed diabetes mellitus in January 2020. He had formal education which is secondary. He is currently a pensioner and previously as property broker. Mr. PH has history of alcohol consumption. He has no family history of diabetes mellitus, hyperlipidemia HPL, and cerebrovascular accident CVA. The medication include glucovans 500 mg twice a day. He is moderately active. He did not do other type of exercise except for his routine of gardening, which is 60 minutes per day.
Medication. Mr. PH is currently consuming T-glucovans for 500 mg BD, which is twice a day. Indication. The T-glucovans can help to enhance glycemic control in patients with type 2 diabetes mellitus, and it should be given with meals. Contraindication. There are certain individuals who need to avoid taking glucovans, such as those who are allergic with glyburide or metformin. Besides, individuals with diabetic ketoacidosis, metabolic acidosis, or severe kidney disease also should avoid consuming this medication. Adverse effects. There are many adverse effects of glucovans. This medication can eventually cause nausea, vomiting, diarrhea, dizziness, and weight gain.
Anthropometry assessment. His weight and height in 2018 are 55.8 kg and 157 cm respectively. The BMI 22.64 kg per meter square indicated as normal nutritional status. Biochemical assessment. His lipid profile showed normal value. Meanwhile, for fasting blood glucose and HbA1c of glucose profile are higher than normal value, which is 8.2 mmol per liter and 8.1% respectively. Clinical assessment. Mr. PH has been diagnosed with type 2 diabetes mellitus and has underlying of hyperlipidemia and all cerebrovascular accidents CVA in 2015. He also experiencing hypoglycemic symptom and feeling hungry at 3 to 4 a.m. since diagnosed with diabetes mellitus. Dietary assessment. Mr. PH eats 6 meals per day. This included 3 main meals, morning tea, supper, and late night snacking to help reduce hunger.
Nutritional diagnosis. Firstly, Excessive carbohydrate intake related to high carbohydrate consumption in every mealtime as evidenced by abnormal high fasting blood sugar and HbA1c level. The second one is excessive carbohydrate intake related to high carbohydrate consumption in snacking as evidenced by abnormal high fasting blood sugar and HbA1c level. For the energy requirement for this patient, we choose to compare quick method and Harris-Benedict. For quick method, the energy requirement is 1953 kilocalorie. Meanwhile, for Harris-Benedict with activity factor of 1.3, which is moderately active, the energy requirement is 1682.5 kilocalorie. Thus, we choose the mean of these two amounts, which is 1800 kilocalorie for his energy requirement.
Here is the calculation for menu planning of 1800 kilocalorie per day. The distribution are 8 exchange for cereals and starchy vegetables, 5 exchange for fish and meat, and 5 exchange for fat. Next, based on this table, the calculated percentage for carbohydrate is 54.4%, protein 14.8%, and fat 29%. The total kilocal is 1780 kilocalorie. So here are some modification of his diet where we advise and recommend him to reduce the portion and also to replace some food with healthier choice. So for the breakfast, he is recommended to take 1 cup of skim milk, 2 pieces of wholemeal bread, and 2 slices of papaya. For morning tea, 6 pieces of small cream cracker and 1 slice of papaya. For lunch, 2 scoops flat of brown rice, 1.5 medium size of mackerel, 1 cup of bitter gourd, and 1 glass of fruit broth. For dinner, 2 scoops flat of brown rice, 1 piece of fried chicken, 2 slices of watermelon, and 1 cup of soup with vegetables. For supper, 1 glass of blended mango juice. And lastly, at 3 to 4 a.m., 1 cup of skim milk. And here is more detailed example of menu for patient for the weekend and also for the weekday. Firstly, while eating, patient can try to drink water in between. This will allow patient to check in with hunger and fullness signals. This can also prevent overeating. Next, educate on food portion. Patient should eat less portion of cream cracker in his daily intake. It can be reduced to 3 to 4 pieces per intake. Patient should also try to eat rice in moderation, which is 2 scoop flat of rice. Educate patient on high fiber intake, which is 2 servings of fruit and 3 servings of vegetables per day. Suggest patient to replace white bread with healthier choice such as whole white bread and replace white rice with brown rice for lunch. Besides, encourage patient to do more physical exercises, 30 minutes per day, such as jogging or cycling with family members, to make it more fun and enjoyable. Encourage patient to gradually change sleeping schedule, sleep early at 10 p.m. every day to prevent from eating too much late at night. In addition to that, quality sleep is also good for his overall health.
Monitoring and evaluation. TCA on the next month. 1 month is sufficient enough to see the patient progress. First, monitor weight and compare it with previous weight. If there are any big changes, more intervention may be needed. This is because diabetes mellitus usually associated with weight gain, and if this happens, intervention of good diet may be needed in order to prevent obesity and diabetes mellitus to become more worse. Next, check for the blood glucose level. If the blood glucose level decreases or at the normal level, the previous intervention can still be used. But If the blood glucose level increase, more intervention is needed. The previous intervention can no longer be used. New intervention may include other type of medication and increase physical activity. Low physical activity may be one of factors that contribute to diabetes mellitus. Based on American Diabetes Association (ADA), in the case of diabetes, it is becoming increasingly obvious that type 2 diabetes is linked to a decrease in physical activity. It is suggested that people get 30 minutes of moderate physical activity on most days of the week. Panayot Dermakakos also said that any physical activity is related to reduced risk of developing diabetes mellitus among individuals.
American Diabetes Association recommends carbohydrate intake in diabetes management includes carbohydrate from fruits, vegetables, whole grains, legumes, and low-fat milk is encouraged for good health. As for the general population, people with diabetes are encouraged to consume a variety of fiber-containing foods. Based on the dietary intake of Mr. PH, he preferred fruit broth rather than raw fruit that actually contain high fiber and less calorie. Fruit broth contain high calorie compared with raw fruit due to additional ingredients such as seasonings and others. It's not really good option as people with diabetes not only have to reduce sugar intake but also need to minimize calorie intake since it can lead to overweight. As we know that people with overweight are high risk in developing other chronic diseases, food with low glycemic index is a good option for people with diabetes as it can prevent spikes in blood sugar level. Foods with low glycemic index includes oats, barley, breads and others. Regarding the dietary intake of Mr. PH, he includes oats, breads and choose brown rice as one of his main meal in dietary intake. Therefore, this can be considered as a good choice for people with diabetes. However, care should be taken to avoid excess energy intake.
How education affects diabetes mellitus? High education can increase the awareness among patients toward the risk factors of diabetes mellitus. Besides, it can help the patient in diabetes self-management. The patient must know how to manage the disease from becoming worse. Education can also help the patient to cope with diabetes mellitus compliance. In Mr. PH case, he is not really aware about the food intake for each meal. Thus, he needs more information regarding the amount of food intake in order to control his blood glucose level. Conclusion: based on the case study, the NCP for Mr. PH has been done by focusing on the diabetes mellitus. This NCP helps to prevent the disease from becoming worse. In a nutshell, the NCP is very important to monitor the progress of the intervention of a patient. NCP also helps the dietitian to plan the correct intervention for each of the patient. Thus, NCP is very recommended to be used for each of the patients.